best papers are the ones that are very clear in structure and that tell a story.
Welcome to the Dental Protection Podcast. My name is Terry Simpson, and this is the Research in Dentistry series. This is the third in that series, and in today's podcast, we talk about how to read a research paper and weigh up the evidence. With us today, I'm very pleased to welcome Professor Tanya Walsh, Dr. Derek Richards, and Dr. Josh Twigg. People that have listened to the first two in the series will know that Josh has been a regular guest and is an academic lecturer at Leeds University. You may not be so familiar with our other two guests, so I will introduce them now. Tanya, welcome, and thank you for agreeing to speak to our listeners on this important topic. So perhaps you'd like to say a little bit about your background and your current role.
Yeah, sure. So first of all, thank you very much for inviting me. It's really nice to be here with you all today. So I'm Tanya Walsh. I'm Professor of Healthcare Evaluation, and I'm also the Director of Research at the School of Dentistry, University of Manchester. I've been working in dentistry for quite a few years now, working in dental research, and I've worked on observational studies, randomized controlled trials, and Cochrane systematic reviews in oral health.
Thank you, Tanya. And Derek, I think you're probably somebody that's quite familiar to the dental world. Many of us know you from the Dental Elf. Perhaps you'd like to say a few words about yourself as well.
Thanks, Terry, and thanks very much for the invite to participate in today's podcast. I qualified a long time ago now, and I worked in several areas of dentistry, hospital, general practice, and community before going into specialist training in dental public health. And it was there that I first became involved in evidence-based healthcare because of training in Oxford, and the Oxford Centre for Evidence-Based Medicine was being established. And as part of my training, I helped set up the Centre for Evidence-Based Dentistry and the Evidence-Based Dentistry Journal, and then subsequently the Dental Elf, which you just kindly mentioned. So I've been involved in the appraisal of evidence, dental evidence, for more than 20 years.
Thanks very much, Derek. I'm going to start the ball rolling by asking each of you to comment on the structure of research papers and what should a reader expect to see in the paper, and how do we determine quality from reading those papers. Tanya, have you any thoughts on that?
Yeah, so most research papers that are published in journals will follow the IMRAD structure, so in some shape or form. So that's the introduction, methods, results, and discussions. And the paper will usually be summarized in a brief abstract as well. So that's really what you should be aiming for. I think the best papers are the ones that are very clear in structure and that tell a story. So there's a clear pathway all the way through the manuscript, and the overarching research aims are laid out clearly in the introduction, and then objectives follow. And then everything that's then reported in that paper should relate back to the overarching research aim and the specific objectives of that research in particular.
Thanks, Tanya. I mean, Derek, how important is to get the question right that you're asking in the research? I mean, I know it sounds very fundamental, but is that an important thing that we should all be looking to?
The question is the most important thing, I think, and it's your starting point, and it's the basis of everything that goes afterwards, because the study design should be appropriate to address the question you're asking. So getting that question right and clear is the first stage to getting a good quality paper.
Okay, thanks, Derek. The first thing that a lot of dentists see, or anybody reading a research paper, is the abstract, isn't it, Josh? And in that abstract, what constitutes an abstract? What should somebody be looking for in that abstract to sort of glean out of the overall tenor of the paper, what the paper's trying to do?
Yeah, so the abstract is like your kind of one-page resume for your study. So it should summarize all the key points of the rest of the paper. So I think it's most useful for actually, before you decide if it's actually relevant to you, So really looking, there should be a clear statement of the research question or the aims of the study within that abstract very early on. And then enough information about the methods and results that you can get a grasp of the key way that they've addressed that question and what the main findings of the paper are. And from that, you can then kind of decide, should I invest my time in reading this paper, or is it actually not relevant to me, or not of sufficient quality for me to spend time on.
Okay, thanks, Josh. Assuming that you do decide that this paper is worth reading, the next section I'd like to come across is the introduction, Derek, isn't it? I mean, what would be contained in an intro to a research paper?
You want to sort of introduce the topic, provide some background, and I think it's very important that you provide the background to why you're interested in this question and why this question is important. And then typically at the end of the introduction section, you then introduce your question. And if you're looking for what the research question is, typically it's placed at the end of the introduction. So that's where you look when people ask you what they're researching. Some people would suggest it should be at the very front, but typically, and in most research, is at the end of the introduction section.
Okay, thanks, Derek. If we're talking, sometimes we hear about the null hypothesis, Tanya. What does that sort of entail? Should somebody express the research in terms of a null hypothesis, or is that something that we wouldn't expect to see in every paper?
It depends on the focus of the paper. I think what's more important is that following on from the research question, I think that you're able then to operationalize the plan of investigation, if you like. And sometimes formulating null and alternative hypotheses can mean that kind of makes that process a lot clearer for the person that's actually doing the analysis, and also the reader, because they know what they're looking at. So usually the null hypothesis is quite a simple hypothesis. So it's usually the one of no difference or no association. So if you're doing a randomized controlled trial, for example, you might say that your null hypothesis would be that there's no difference in the mean OHIP scores between the intervention group and the comparator group on a time frame of 12 months follow-up. So that would be kind of quite a nice, comprehensive, clearly formulated null hypothesis. And then you'd look at investigating that with respect to the alternative hypothesis, was that there is a difference in the means between those two groups on that outcome at that time frame. So it can really, really help. But again, I think with all these things in statistics, I think it's really important to make it clear from the outset that really we're not doing anything fancy here. We're not applying any really hard techniques. We're not doing anything to scare people off. It is more about kind of clarity and process of investigation. So when you do start to come across these terms like null hypothesis, alternative hypothesis, just kind of try and look behind the definition really and see, well, what does that mean for me as somebody who undertakes research or somebody who consumes research?
Okay, thanks very much, Tanya. Josh, if we're looking at the methods section in a paper, what sort of things should a researcher include in telling his or her audience? I'm thinking there about who's participated in the study, etc. Should there be certain criteria that we should be looking for instance?
Yes, it's typically with trials we look at something called PICO. So that's an acronym that stands for participants or population, intervention, comparison, and outcome. And that can be loosely applied to most other study designs with a bit of modification. So the population is who is in the study, and that allows the reader to know, is this population applicable to the kind of people that I see? So it's a good indication of whether you can actually generalize those results to your own patient population. The intervention is what you did, the experimental thing that you did to that population. So the new treatment that you're trying to implement, for instance. The comparison is usually either no treatment, whether that be a placebo control or a delayed treatment arm. So you don't treat someone for whatever the issue is over the course of the study and then implement that afterwards. Or it's whatever the current standard of care is. So for instance, if you're looking at a new toothpaste, there's not much value in showing that your new toothpaste is better than no toothpaste. It's much more useful to show that it's better than whatever the current market leader is, or a standard toothpaste that's out there. And then the outcome is what you measured and also how you measured it. And that's quite important, because outcomes should be relevant to clinical practice, and they should also be relevant to patients, the population on whom the outcome is collected. So we see a lot more now talking about things like quality of life. Tanya mentioned OHIP, which is an oral health related quality of life scale. And these are things that are more likely to be directly relevant to your patient population.
Okay, thanks very much, Josh.
Terry, just to add something, in terms of the methodology and reporting in studies, there are a whole load of guidelines that are available for different study designs.
Mm-hmm.
I suppose the one that quite a lot of people know is CONSORT. So it's a consolidated reporting of randomized controlled trials. And a lot of these have their own websites where they give you all the details, but probably the best website to look at is the Equator Network, which has over 300 different types of study designs and tells you what you should be reporting. So it's a useful resource for people to go and look at.
Derek, while we're on that subject, we should perhaps mention that we've talked about this in the first two episodes about the difference between qualitative and quantitative research and how they both have a very important role to play. Have you any thoughts about that?
I mean, yes, they do both have an important role to play. I think one of the things, and we tend, because teeth are easy to count, we tend to focus more on quantitative methodologies within dentistry, although increasingly qualitative methodologies are being more frequently used. And I think they, in a lot of circumstances, in order to understand why we get the outcomes we do, we need both qualitative and quantitative studies. I think there is a bit of a misconception that qualitative studies are easier to do. And I think qualitative methodologies can be as complex and as difficult to understand and deliver as quantitative ones. So I think those are things we just need to be aware of.
Thanks, Derek. Tanya, as a statistician, you could perhaps explain why randomization is in studies, if it's possible to do it would be an important feature that we would look to include in our designs.
Yeah, sure. So I think the first thing to think about is the study design and whether that's appropriate for the particular research question that you're interested in. And some research questions won't be amenable to randomized controlled trials. So if you look at an evaluation of community water fluoridation, for example, you're unable to randomize that intervention for people to receive that or not because of the way that the intervention is deployed. And so we need to make sure that what we're doing is appropriate, and allocating individuals to groups or looking at group formations. Randomization's one way of doing that. The benefit of randomization when it's done properly is that it allows an equal distribution of known and unknown confounding factors, things that can potentially affect the outcome. It allows an equal distribution of those between the two arms so that we can have confidence that if we are able to detect a difference in the outcomes between the two groups, that we can attribute that to the result of the intervention rather than any other factors. And that's why randomization is particularly important.
Okay, thanks, Tanya. As one of the most important parts of any paper is really what the results are, obviously, and how these results have been produced and what analysis has gone into producing those results. Is there anything we should be looking for in that section, Tanya, while we're actually, when we're reading a paper? How does somebody who perhaps doesn't have a great understanding of research methodology pick out the important features of those results?
So yeah, it is difficult, isn't it, when you don't have a solid background in this, and that you are kind of taking things as written, you are taking things at face value. And so I think it is, if you are interested in becoming a serious consumer of research, then I do think it's worth trying to get some background in understanding potential biases in the different study designs, so that then you are able to appraise whether the results, whether you can have confidence in those results and the story that those results are telling you. And so it's important to evaluate kind of firstly the actual study design of how it's been designed and how that research has been conducted, and then look at the results. You'd also be looking to see that there was some protocol that was guiding the research, so that the methods and the planned results are all laid out, and then you'd be able to go back from the paper that you're looking at if you're able to get hold of the protocol. And usually these are published in journals and quite accessible now. So you'd be able to evaluate whether what's being reported in the manuscript, in the paper, is actually what the investigators set out to do when they started on the research pathway. You'd want to know whether the results are being reported, whether they're being reported as intended. You'd want to know whether all the results are being reported. So, for example, if there was a study that had planned outcome assessment at 6, 9, 12, and 18 months, and then if your paper only reported the results at 12 months, then you might say, well, what's happening with the information at the other time points? Perhaps that isn't giving as favourable a result as the time point that's been reported, and then that might start you thinking about whether potentially there's some bias in the reporting there. So all these things are kind of like looking back to how the research was intended to be done, to see whether it's reported that way. In terms of the actual presentation of the results themselves, as Derek has mentioned previously, there are a number of reporting guidelines, and really, I think the onus is on journal editors to make sure that those checklists for reporting are used properly, because by the time a paper gets published and into the public domain, then readers should be able to have confidence that all the information is in there that they need in order to kind of critically evaluate that information that's being published. So we're hopeful that the results section would be publishing the results of any statistical analysis that's been done, that they're looking at reporting the results for the primary outcome, but also for the secondary outcomes too, that they're looking at reporting information at all the time points that were intended. And also in recent years, there's been a move away from the traditional method of hypothesis testing with a threshold for significance. People have always heard of the p less than 0.05 or less than 0.01, which is the holy grail of any research that you want to do. But what that does is it just provides you with an indication that something is significant or not, but it doesn't actually give you an indication of the magnitude of the benefit. So in the population, do you know how big a difference between two groups could we expect to see? And that's some information that you could get by the addition of a confidence interval. So you'd be looking at the difference in means between two groups and an accompanying confidence interval to then give you an indication of how big or how small that difference you'd expect to see in the population.
Okay, well, thank you very much, Tanya, for that. I mean, Derek, sometimes I've heard it said that some studies are underpowered. Is that a big problem in dentistry?
Yes, I think it is a big problem in dentistry. I mean, this is why it's important to have statistical involvement at the outset, because you want to know what outcomes you're looking at, and you want to know what is a clinically important difference, and that's where then you need to discuss with a statistician, based usually on previous studies, how big a difference you're expecting to see, and then you can work out approximately how big the sample size is. And to do that, you use something called a power calculation, which is the realm of the statistician, and it's one of the questions you're going to need to ask your statistician at the outset.
You need to know how many participants to have to start with, don't you, really, before you start any study?
Yeah, and it's vitally important. If you haven't got enough people to show a difference, no matter how well your study's done, you're not going to show it, you're not going to see a difference.
Josh, we come to the discussion section. Is this an area where we always just take what's been given to us by the researchers, or do we actually have a look at it in more detail, or do we apply our own criteria to it? I mean, I think it's probably a bit of a leading question.
It's a very leading question. Yeah, so you would expect a discussion section should give a brief summary of the key findings of the research. It should talk in some depth about the strengths and importantly the limitations of the research. So any issues with the design, or some of the issues that Tanya raised around the way the analysis was done. For instance, if you had a planned 18-month analysis and that wasn't undertaken, there might be a reason why, and discussions perhaps the place to justify that decision. And then it should also put the findings of the paper in the context of the broader research, and maybe talk, if we're talking about clinical research, about how that would apply to practice. Often what you see is lots of time spent discussing the findings and their implications, and a bit of time devoted to the strengths of a paper, and then lip service to the limitations of the paper, quite generic discussions that show maybe a lack of kind of real critical insight into some of the shortcomings of studies. And that's where we have to start to really think about potential sources of bias.
Mm-hmm. Mm. I think there was a lot of problems sometimes with harms being reported, or in papers as well, isn't there? Sometimes that's not always properly assessed as well when people do their studies. But I think definitely it was a big issue during the time where people talk about masking, for instance, during COVID, etc. There was very little about what the other side of the coin maybe. When we're talking about resources on the net, Derek, is there anywhere that people that have been kind of inspired to go and look at doing more information, getting more information about reading papers should go? And I think we may have touched on this a little bit earlier.
The CASP website is quite useful. It has a range of tools that's the Critical Appraisal Skills Program. CASP.org is very useful because it has a number of worksheets for how to appraise papers. That's very useful. Talking about statistics, the Students for Best Evidence has a very nice summary of a range of statistical points, some of which we've touched on today. Centre for Evidence-Based Dentistry has some useful links. So those are useful resources, and there are plenty out there. And I've got links to several on my websites.
Yeah, thanks, Derek. Publication bias, Tanya. Now, we hear quite a lot about this. Is this something we should be concerned about? And what is publication bias? It's maybe a term that's sort of kicked around, but it's maybe not something that's fully understood by people.
Yeah, so publication bias is bias in the manuscripts that get published, and it's the decreased likelihood of something being published according to place of origin or the language that it's written in. And it's particularly important when we're looking at secondary analysis, or we're looking at systematic reviews. When we're doing a systematic review, what we want to know is that we have all the available, relevant, timely evidence for that systematic review. And if there are reasons why certain research isn't published, then that means that we're only seeing a small subset of all the available evidence, and that's why it's particularly important. It used to be more of a problem previously with publications that have negative results, or what used to be termed negative results, or insufficient evidence of a difference is probably more a correct term now, because those publications weren't considered to be useful because they didn't show that there was a benefit of one intervention over another. So in terms of negative results, journals are coming more on board now, and I'm sure that Derek would be able to back me up on this, that in terms of publication, then it's actually the value of the research that's important rather than whether the result is deemed to be significant or not.
Thank you very much for that, Tanya. Very last word now on this. Josh, could you just say about how we could maybe get some, if we have got a paper, how we can sort of manage change in practice, and are any of these results that we can actually bring into our practice? What would determine that?
Yeah, I mean, it's an important point, because the value of research is in driving change in practice. I think that the first comment to make on that is that a single paper is unlikely to be sufficient grounds to change your practice. So you risk kind of yo-yoing between one study and another if you work in that way. But when there's a sufficient body of evidence, and Cochrane reviews are a good resource to look at kind of summaries of the evidence in an area to support making a change, then working out an effective way to implement that change is key. And there's different barriers to achieving that. So there's the innate difficulty of changing individuals' practices. So you want to implement a new treatment, and people may be stuck in their ways, so to speak. And then there's broader systemic factors that are much more challenging to manage.
Okay, well, thank you very much, Josh, for that. Right, very, very quickly, I'm going to go around each of you and ask you if you've each got a tip. Derek, one top tip for our listeners really on reading papers.
Well, the first thing to do is to read the whole paper. Most people only ever read the title, abstract, and conclusions.
Okay, thanks, Derek. Over to you, Tanya. Anything you can think of?
Yeah, I think that look carefully at whether the author's conclusions are actually supported by the results.
Okay, thanks. And finally, Josh, have you got anything you'd like to say there?
Yeah, I think making sure there's a clear research question and the actual basic design of the study is appropriate to answer that question is another important factor.
Okay, well, thank you very much, each of you there. And with that, we reach the end of today's podcast. If you'd like a certificate for listening to go towards your CPD, or to learn more about what we covered today and who you were listening to, please do take a look in the podcast description. I've been your host, Terry Simpson, and thank you for listening.